Hey everybody, and welcome to the September 21st Q&A call. And this is Kathy Randall. And I thought on this call today, what we would do is go over a question I get quite frequently. And that is really, what are the steps when you are setting up your aEEG program in your NICU? And so I've just kind of outlined a few of the essential things that I think that are important to keep in mind. And I hope that this gives you a little lay of the land as you're planning your program. So let's start with kind of the obvious things, which is you need to gather a team. And so this needs to be a multidisciplinary team. So physicians, nurses, neurologists, neonatologists. You might want to get some people from IT involved, as well as, of course, bedside nurses, advanced practice nurses, just a really well-rounded team, because you're going to need to come at education and support from a lot of different angles. So getting that team, getting some people who are excited and invested is really going to be critical to getting your program up and running. The next thing to do is to choose equipment. And I have a few examples of some things you might want to keep in mind related to that. We actually did a Q&A call back, I think, in March, where we actually went over several different types of equipment in a lot of detail and kind of the pros and cons of the different devices that are out there. So I just want to encourage you to go back maybe and review that, but we'll give a little high points on that. Then in the aEEG course, in Module 2, we talk for almost an hour around the roles that we can divide. So I'll just give a little kind of quick refresher and reminder if you haven't been involved in the course or you haven't gotten to that yet. We'll just go ahead and go through that. So number one, gather your team. And then number two, choosing that equipment. So really on the market right now, there are basically three kinds of devices. So you have your standalone aEEG device. This is just going to be a device that its only purpose is to do aEEG. These may or may not connect to your hospital's network. These may or may not have printers. They may or may not have video. Typically, they do not. And they typically don't really interface very well with your hospital server for being able to keep your files archived long term. So although these are great standalone, easy to use devices, they have some of their limitations as well. The next kind of obvious choice would be to have an EEG device that's being used by your neurology or neurophysiology department. And so now we can get aEEG trends added on. So it's just a software algorithm that can be added to a standalone EEG device. The advantage of this is you have now one piece of equipment that can then serve several functions. And it also typically these devices have video, which is really helpful when you're looking at that. Looking at the tracings and trying to look at artifacts. And the other piece of this is that because the EEG department has purchased it, it probably already has all of the hardware that you might need for connecting into your server, for remote viewing, and some of those other pieces of data management that become very time consuming. So, those are some of the advantages, but then if you're borrowing it from neurophysiology and you want it at the bedside, these are usually larger devices. You may have limited access to them because, again, they might be owned by another department. So it might be the NICU's responsibility to buy these instead of just borrowing. So, and they're a little more expensive. So that's kind of one of those other things to keep in mind. The third category is a category that I'm starting to see more and more, and this is what's called the multimodal. There are a couple devices out on the market that are now available, and the multimodal, what is really nice about them is that they display on one screen various information from various monitors. So for example, you might have it connected to your Blanketrol device while a baby's being cooled. Maybe you have it connected to your NIRS device for a cardiac baby. Maybe you have it connected to the Philips monitor for a preemie. And so by being able to have your aEEG and being able to also have other physiologic data like temperature, heart rate, saturations, regional saturations, you can then begin to see the neuro trends a little bit easier. The other nice thing is it saves space, because we've actually at one of my hospitals, we've mounted the NIRS device onto this device, so that when we have it at the bedside, it's just one device instead of two at the bedside. So again, I think we're kind of moving towards this ability to see many trends in one. So again, I think it's important to think about, your access, your internet access, your space issues, who's going to be using it, the frequency you're going to be using it, to maybe decide which of these is right for you. The second thing to think about is, when we talk about your aEEG program, there are many, many roles that need to be considered. And so we've talked already about equipment, but then there's supplies and supplies management. Who's going to identify the patients? How will they be identified? How will you track them? Who's going to actually set the device up? Who's going to be responsible for reading it? So I think, looking as we kind of go through the whole entire presentation today, thinking about these different ideas, and then really starting to begin to divide that up. So again, in Module 2, this is one of the worksheets that you got. So just as a reminder, might be good to pull that back out and just kind of look at where are you now, and maybe where are some of the gaps, and maybe some of the frustrations that you've been challenged with. This might help to figure out, oh, we don't know exactly who's supposed to be doing that. So let's get a little clarity around that and help everybody out. So the next kind of thing to think about, and I just alluded to it, is just creating some protocols for use, and then documentation. So of course, we want to take credit for the work we're doing, and make sure that we're providing for communication amongst providers for the information we gather with aEEG. So as far as creating a protocol, I think it's important to think about several different layers of the actual experience of using aEEG. So first off is really, when you're thinking about your protocol for use, it's really the which monitor, what type, when are we going to pull it out, and who's going to be monitored, and even potentially for how long. So those are all important to kind of think about, what creates that need. When do we do this instead of EEG? So having a conversation maybe with your neurophysiology department, that will be really helpful. Another part of the protocol is the electrodes. So who's going to place them? Are they going to be the ones that you get from your neurophysiology department? Are you going to use needles? Who's going to put these on? Who's going to maintain them? And then who's going to remove them and do the kind of ongoing, skin assessments and things like that. So that's another piece. And then, of course, once you get the electrodes on, once the monitoring's in place, then it's important to have a protocol set up, a standard in your unit of who's going to interpret the tracings and how frequently. So is it going to be once a shift? Is it going to be the nurses at the bedside once an hour? So just who's going to be doing it and who's going to be looking at that. The other piece of this is documentation. So yes, you put the device on, which device, looking at the skin, but then who's really documenting that interpretation as well. So at Stanford Children's, where I do some consulting work, this was something that we created. We started with top 10, and now we're at top 12 priority diagnoses for the Neuro-NICU. So what we did is we chose our top 12 types of babies that would be getting admitted to the Neuro-NICU, the kind of monitoring that we wanted to provide for them, whether or not they would get an automatic neuro consult, whether they would get an automatic high-risk infant follow-up visit, all those kinds of things, and just tried to give some guidance of how long the monitoring might go on for these specific babies. Of course, these are just guidelines, but it's been really helpful to at least have a place to start where we're saying these are for sure babies that we're monitoring. So again, we talked a little bit about who's going to look at the tracings, how often, and And again, looking at them and making sure there's no changes, significant changes to the background is one thing, but then who's going to be responsible for interpreting the tracings? What does this tracing then mean for the baby's care? And so I think that really lies at that provider, practitioner, physician level. But looking at the tracings, that's really everyone's responsibility. So being able to teach to what is normal, what is abnormal, what are those high alert situations that you want someone to be notified? And then if someone needs help, who do they contact? So who are your super users, and how do you get support? Some of this is just if you're by yourself in a unit where you're just getting started. This is where I'm hoping that the aEEG forum and of course our Facebook groups can be helpful to you, where you can maybe take a anonymous snapshot and post it up there and get some feedback from others so that you can continue your learning. And certainly that's what these Q&A calls are for too. If you want ever, send in a few snapshots or present a case, I'm always happy to have other people involved in sharing their experiences with aEEG. So the kind of next section is really, in order to get people comfortable with looking at the devices and to be willing to document in the medical record, it's important to really do a lot of staff education. And again, this is maybe divided into several groups of people, whether you have your group of people who are going to maybe be your equipment super users and applying the device and applying the electrodes. That might be one group of people. And then you have the bedside nurses who will be caring for the patients and maybe teaching them in a little more detail about the tracings, about how to document marking events and other important things on the device, the kind of day-to-day, moment-to-moment use of the device. And then you have, of course, the need for people to know how to interpret and what is normal and abnormal for different ages, for different types of cases. So this education can be done a variety of ways. I love online education. It's accessible to everyone. Everyone hears the same kinds of things. And I think that that's a great way to give education. Certainly, there have been several studies. Actually, we're getting ready to present a poster on the effectiveness of this in one unit. On doing some online education and some quizzes. And certainly, that's been a really effective way for me to provide education to large groups of people as well. So I think it's important to really plan what works best for your staff. Utilize your vendors. Your vendors, you've paid for equipment, and they are typically really excited to provide some level of support and education. Obviously, they can't live with you on your unit for 6 months or a year while you're getting up to speed, but I know that they want you to be successful, and I would just reach out to their clinical specialists and to their online educations that many of them offer, and just stay plugged in with them and be really clear that you need maybe some support. And certainly ongoing support is something that I try to offer with the aEEG coach, but I know a lot of these vendors, they want to do that as well. But so staff education, probably online, some stuff in person, maybe some videos on your intranet, and really developing a group of super users is really gonna help. And then I think really picking a day to just begin. And even if it's that you don't have a really sick baby that's there, once you've got everyone educated, it doesn't do any good to wait. When I used to travel around and do trainings on site, I used to just tell people, let's go and put this on a baby right now while it's real and it's fresh. And I think that a lot of times we make the mistake of training people on these types of new devices and new care practices, and then we don't roll it out and give people an opportunity to practice in real time. So I think that's really important that you do pick a date and just begin. And whether or not that's just a rule out sepsis baby, or maybe it's a baby who's on phenobarb or you've weaned off phenobarb recently, I think it's important to just get the monitors on babies and begin to even see normal patterns. That's even better. So then finally, the thing that I think is important is to realize that this is not a one-time education, one-time implementation that this is a long-term process, and setting up your aEEG program will take time. It will take dedication and commitment over probably a year or more. And I think that what's important is to know that you need to just constantly be reminding people about the value of aEEG, about the uses of aEEG, and then to provide them with some case examples of how it's been working in your unit so that they can really become passionate about using it. So it sometimes feels like a lot of extra work to set up the device, and you're learning how to read them. But I think if you can at least set up monthly reviews where you can share a case that was from your unit, and again, even if it was a normal aEEG, but it was for some reason you were suspicious about something, and going ahead and just sharing with the staff and all the providers at all levels, here was a baby, here's his background, and here's the aEEG, here's what we learned from that, here's what it told us, and really just giving people some opportunity to just digest and continue to reinforce that the tracings as well as the usefulness of aEEG. And then finally, plan for more education. So I think at least a minimum of once a year with your annual kind of refresher education that you offer for staff. Definitely as you onboard new staff, I think, talking to them about what aEEG is, and maybe even just, again, taking these cases and posting them so that people on all shifts, on, weekends and everything can see the way that aEEG is being used in your department. So I think it's not a short-term process setting up an aEEG program. I've worked with some units over several years as they've rolled this out, and even the places around the world that have been using aEEG for decades, literally for decades, they still have to review these things, these very simple things all the time, and continuing to just assess where you are and how you're using the device will really serve you well and will help you to serve your babies even better. So these are the basic steps: gathering your team, choosing your equipment, dividing up the roles, creating protocols for use, figuring out where you're going to document, who's going to document, and when, planning staff education, picking a date for when you're going to start, and just start. Then that periodic review, and then planning for more education in the future. Of course, if I can help in any way, I'm always happy to assist, and please always feel free to reach out to me if there's any part of your program that you're needing some extra help on. We have a lot of experienced users in our Facebook group and in our online forum, and I know that they're all willing to share tricks and tips of things that have worked from them as well. So that's really why we wanted to create the community, is to be able to share our successes as well as our challenges, and they're very common no matter where you are in the world. So our next live Q&A call will be on October 26th. It will be after the Brain Monitoring Conference and the Vaughan Conference that's happening in Chicago. So many of you, I know, are planning to attend many of these events, and so I hope to see pictures and updates from all of these things. So until our next call, have a great week and talk to you soon.